into A&E with lower abdominal pain.
Sidrah, please.
Yep.
Yep, want to come through? Good morning, I'm Dr. Westwood, the junior doctor here today. Can you tell me why you come into A&E?
I have pain in the tummy that comes and goes.
Okay.
It's been around for a couple of days now. I'm really concerned.
Right, okay. Whereabouts the pain generally start?
It's around here.
Right, okay.
Sidrah points to the right iliac fossa.
And does it just hurt there, or does it spread anywhere else?
Well, it's mainly here, but occasionally it goes generally.
Right, okay. When you say it comes and goes, can you be a bit more specific about that?
Well, it's a dull ache that sometimes hurts really badly and then fades away.
Right, okay. And when did it roughly start?
It started gradually, but
Right.
now it will go away.
It will go away, okay. And is there anything that makes it better or worse that you know of?
Yeah.
Okay. Have you got any problems going to the toilet at all?
No, no problem.
And when was the last time you went to the toilet?
Yesterday.
Yesterday. Okay. You're generally fitting well apart from the pain?
Yes.
You know, no allergies that you know of?
No.
Not taking any medication?
No.
Okay. There's nothing, no one in your family that has a similar problem that you know of?
No.
No?
Not bad at all.
Okay. Do you mind if I have a quick feel of your tummy? Is that alright? I'm going to swing your legs up onto the bed. Make yourself a bit comfortable there.
Dr. Westwood would normally wash his hands, inspect the patient, and then examine the hands and the face. Her pulse was recorded at 70 beats per minute and a blood pressure of 110/60. Dr. Westwood now performs the abdominal examination.
Okay, so let's have a quick feel of your tummy. If it hurts anywhere at all, please tell me and we'll stop, okay? So this is where it hurts the most, down the bottom here, okay?
Yeah. Ouch.
Dr. Westwood would then auscultate and percuss the abdomen.
Excellent. You can sit up now, that's fine. Would you mind me doing an internal examination today?
No, I'd rather not.
Okay, that's absolutely fine.
Can you excuse me for a minute? I'm just going to make a phone call. I'll be back in a minute.
Should we leave the room to phone the rest of the family?
Okay, I'm just going to consult my senior doctor. Is there anything you want to ask me at this stage?
Well, there's this one thing. I've been seeing this guy from school, and we've been sleeping together.
Okay.
And we kind of had this accident last week, and I would really like to find out more about contraception for you.
Right, okay. When was your last period?
I can't remember, but it should be normal.
Right, okay. Well, unfortunately we can't prescribe you emergency contraception because you have to take it within 72 hours of the of sexual intercourse. But what we can do is give you a pregnancy test, and when the results come back we can talk about contraception then. Is that alright for you?
Yes, but there's one more thing. Please do not tell my parents, my mother. Yeah, but I think she's cool with it, but my auntie and uncle are probably going to kill me if I find out that I'm dating a Caucasian boy.
That's fine. Everything we talk about is completely confidential, so don't worry about that, okay? As I said, I'm just going to consult my senior doctor, so if you mind waiting in the waiting room, I'll come back and get you in a minute.
Yes, thank you.
Dr. Westwood leaves to talk to his consultant.
Ma'am.
Hi there. I just had this case this morning. I was wondering if I could go through it with you.
Go.
Excellent. Okay, the girl is a 15-year-old girl named Sidrah, and she presented with colicky abdominal pain, mainly in the right iliac fossa, which has been going for about 48 hours. She's not constipated, and she's got no vomiting or fever. On examination, her blood pressure was normal, and her pulse was normal, and she's well perfused. Palpation, she was tender in the lower abdomen, with no guarding or any masses that I could feel. Bowel cells sounded absolutely fine, and she is sexually active, and she did have unprotected sex last week.
Right, what are your differentials?
Well, obviously I was thinking about pregnancy, either normal or ectopic. It could be PID or appendicitis. Another one was UTI or STD. But I was also thinking about psychological, because she is hiding a relationship from her parents, and the fact that she had unprotected sex last week. She might be a bit worried about that.
Have you considered endometriosis?
I have, but I'm thinking a menstrual cycle is normal, and I thought the normal age for endometriosis was about 30 to 40 years.
That's right, but it is still possible, so don't count
Right.
it out. Okay, well I think infection is unlikely,
Okay.
because the pain's constant.
Yeah.
it wouldn't, well, the pain would be constantly with infection,
Yeah.
and there's no systemic symptoms or fever. Also, there's no pain on urination from what you said, so I think UTI is less likely as well. Start with a pregnancy test, then do an ultrasound for any obstruction.
Okay.
I'd do a full blood count and urine sample to check for infection just in case.
Yeah.
Try and get her to give you a high vaginal swab and then a cervical
Right,
swab
okay,
to check
yeah.
for chlamydia and other STIs.
Yeah.
And if all of those are normal, then do a laparoscopy to check for endometriosis and come back to me when you've got the results.
Okay. Thank you very much.
No
Cheers.
problem.